surgery, progressing within a surgery, or even using this as a sort of pathway to stepping onto a career in any of the caring professions, then you will live with reflection for quite a while. So getting it right now and not being scared by it and getting your head around it is really important. And that's the way I've written it. So it's not a big sort of theoretical presentation or academic in any way. It's really, you know, the bare bones of it and how to make it easy for you. So with that in mind, that's why I'm asking, is there anything else in particular? I'll try and relate it to certain scenarios, but perhaps you've just asked a couple, so we'll probably use some of those. But if anyone has any particular scenarios that they want to talk about that they're finding difficult, then again, this is the time and we can sort of talk through it. And it's all in confidence, and you'll be able to go back then and complete your reflection if you want to. So like I said, you can do reflection from a very academic point of view, and you'll often see, certainly at the higher levels, you know, 6, 7 of academic writing, that there'll be a whole module basically around write an academic paper, write a reflective paper on a particular topic. And that is, it's talking about reflection, it's talking about looking back, but it's very, very academic, and you need to reference all the way. We don't expect any of that really here from you. So what I'm saying is that reflection really is, it's just a process of making sense of an experience in order to learn and improve. So that is one of the first things, is that you are taking this into account. Something has happened and you're looking at it and you're thinking, this has happened, I'm going to have a think about this, I'm going to analyze it, and then I'm going to learn or do something differently from it. And it is about learning. It may be something better, and it may be that you're thinking of changing the way you do it. And we do it all the time without thinking. And I'm sure if you just close your eyes and, you know, think of something, that a simple thing that you do at home, you walk out and you forget your keys and you're locked out. And then you think, okay, so that's what's happened. What do I do next? What's my plan for this the next time? You know, how do you analyze, how did that happen? I was distracted, you know, whatever was going on. I walked out, now what? Okay, I'm out, I'm stuck without my keys. How am I going to make sure that this doesn't happen again? And so you have your action plan. So that's a really sort of quick way that you would do it. There's a reflection. And it's just applying to something that's happened in your life that you're doing every day. With these, so reflecting in health is really doing the same thing, but we're doing it in our encounters with people at work or patients or things that we're doing every day. So it has huge benefits for the patient, because obviously we're critiquing things that we do, we're trying to make it safe, we're learning from mistakes, we're identifying mistakes, and we're learning from those mistakes. And has huge impact, like I said, from the safety of the patient, but also from the professional or the practitioner, where they're able to grow and develop. One of the things that, again, and my background is in nursing, so I will refer to that, is that we were often encouraged to keep our reflective diaries over a number of years, and to sort of from time to time just flip back, and you would see how you would grow as a professional. You know, what you had written in your first year and then third year or fifth year, if you came across the same thing, the breadth that you would sort of examine and scrutinize was incredible. And so I'm sure for you, it will be quite interesting to, in your portfolio, to keep these, and maybe a couple of years down the road to look at some of those, and you'll understand then what I mean about how you get good at this and you become good at sort of analyzing and thinking around it. So we know that reflection involves the describing bit. So we'll move on in a second and we'll talk about those models, but there'll be a bit of describing. So that's the what's happened. There's the analyzing. So again, where we analyze something and we're examining. When you're saying analyzing, you're examining something methodically and in quite a lot of detail. And really what you're wanting to do is explain it to yourself, or to interpret it in a way that makes sense to you. So the evaluating then at the end is usually where you're forming an idea and you're making an assessment about what has happened. And then there's a bit of synthesis in there as well, where you combine it all towards the end. You're bringing it together to make something sort of a whole package. Instead of different steps, you're making it whole, and you're thinking about what you're going to do, which is your action plan. So again, you'll see what, and if we move on to the next slide, what I've really just described is the Gibbs reflective cycle that you use and that you've been encouraged to use. And this is just one of many that is available. They're all very similar, to be quite honest. They're all written at various times, and they are really just a methodical way of going through so that you can cover everything that we've just talked about, that it will be a critical reflection. So you're not just saying, oh yeah, everything is good. You're looking at the good, the bad, how you got there, all of the thing within here, within the actual cycle itself, but also that it's sort of making sense to you, that you're bringing it all around, like I said, that synthesis, wrapping it all up so that when you get to the end of it, something has happened. This is what you've thought about it, and this is what you're going to do at the end. And lots of these cycles, like I said, Gibbs is probably one of the most important ones. There's another very simple one that I've brought along, and again, if we could go to the next slide, if that's okay. And this is the Rolf model, and they're simple. Actually, most of the time, even when I was thinking of this, I didn't remember that it was Rolf. It's the what, so what, now what, now what. And this one for me is whenever I'm writing, even if I'm using one of the bigger models, the frameworks, so the Gibbs, all the way, this is the question that's going through. It's like the surly teenager, the what, so what. And that really makes me think about why I'm writing what I'm writing when I'm thinking about my reflection. It also helps to stop it being too descriptive. And we'll talk about the description as we go through and we look at, and maybe even, like I said, if you bring up one of your examples. So this is a really simple one, and this is all that is to it. And even when you're writing the Gibbs one, it's possible to keep that there just in your head as you're writing something. You have this mantra going through so that it helps you to sort of develop your idea and to get it down on paper. And the other thing is that often you need to do several drafts of this. It doesn't really flow particularly nicely if you sit down and write it. It is a piece of work that you need to think about and do various bits and scraps of paper, and we'll talk about how to do that afterwards. When you're doing that final one that you're going to submit and put into your portfolio is really the refined piece, because remember, you will be expected to write at a certain academic level. I think it's level 4, and there will be some academic credits, hopefully, coming with this. We said it's 10, isn't it? And so academic level 4 is like first year of a degree, I think. So that's the type of work that you'll be expected in terms of writing it, the English that you're to use and the sentence formation. Was it possible to okay, we're just getting a little bit of interference there. And so important to think of that as well, I think. Again, if you want to progress, if you want to use this as a stepping stone to something else, it will really benefit you in that way. Next slide, if that's those are just two models. One you've been working with a lot, the other I've told you just to hang on to in your head and keep those questions near to you when you're doing it. We talk about lots of things that you can reflect on, and I know you're doing it. A lot of it is around your clinical exposure, but there are another number of things that you can also, which might, when we talk about conflict, or perhaps you asked about that, that instead of thinking about an encounter, a clinical encounter, there will be other ways that you will be able to say that you brought it in. So these are basically just a few of them. It might be a team meeting and something they're talking about a difficult patient, or you know, an aggressive patient, and how is that, and that would be your conflict in a way, because you're talking you're basically, what you're saying is, oh, this was the meeting and this is what we discussed, and you can bring it in like that. It might be that it's good practice, so somebody is commented on that there was you know, something went well. It's difficult sometimes. You almost need somebody working with you for them to say, yes, that was spot on, you know, according to the sort of textbook of procedures, you know, you did everything really well. And so that's really nice when you get a positive thing. But reflection isn't always about good things. It is about how we make sense of the bad things as well. So some of it is, again, it may be that there is a particularly complex patient that you can bring into lots of your different things, incidents or near misses, so those serious untoward incidents that you will all have a policy for in your practice. Safeguarding is another really good one that it's really nice and really rich to get some information around thinking about if there has been a safeguarding incident that you were involved in. And of course, there are safeguarding meetings in most surgeries. And so really good to sort of demonstrate how you're reflecting on practice and how you're reflecting on safety if it's around a safeguarding incident. Journal articles, journal or an article, any of these, again, that's another way of reflecting that you've learned something. And if you were to not be able to see something or demonstrate something, then as we said, practice doing it on the on an article like that is possible. Slightly different with phlebotomy because it is a hands-on thing and you'll be expected to do it. So, but there may be some other things, and like we said, around the glucometer, absolutely, it's fine to do something like that. And obviously, all your discussions with your clinicians, again, that may well be going on as part of your clinic, but then if you were to pick one thing that you talked about afterwards, then you'll be able to do a reflection on that as well. So, these are just opportunities rather than just saying, oh, I worked with somebody and this is what we were doing. If we move on to the next one, please, Summer. So what is reflection and what isn't it? So it is writing your thoughts. That's really what it is. It isn't a summary or a detailed description of what it is that you've done. And I know in previous conversations, we've said you need to let people know. That's your way of demonstrating that you know what to do or how to do things. And I was trying to pick up on that a little bit earlier. It's about the how to do it and why you do it. So there's the knowing about it is two different components. One, it's the procedure. It's, you know, you can pick up, say, the glucometer, you know what to do, you know where it is, you know how with the device that's in your surgery and what to use it, and you can demonstrate that. That you will be demonstrating to your mentor in practice. So that's about being competent to actually do the doing of the activity. And you will demonstrate to them. What we're looking for in your reflections is the understanding why you do those things. So like we said about, I get the glucometer out, I turn it on, I make sure that it is calibrated, I make sure the fluid is in date, I make sure I've got enough strips, I wash the patient's hands. This is all very procedural. It's how you do the procedure. We don't really need to know that in the, and that this is an example, there may be others, don't really need to know that because that is, like I said, a step-by-step procedure. Your person, your mentor that is watching you, observing you and signing you off as competent need you to see that. If you go to a different surgery or a different room even, sometimes it might be a different device and you have to go back and learn how to do it. Also, if you do that step by step, you're just describing what it is. It's not a reflection, it's a description of what you do. So it doesn't really fit the bill. What we want to know is your thoughts around it. So this is, I've done a glucometer, I've done a blood glucose on someone, and it's the why you do it. What you would do if there was something wrong. So it's, like I said, the doing it, but it's also the knowing what it is about, why you're doing it, and what you'll do if it's in or out of the correct numbers, say. So, you know, if the patient's sugar is like 3.3 or 23.3, what are you going to do? Do you know what a normal is? So it's that knowing that goes with the procedure rather than just how to do the procedure. So does that make sense about what the reflection is?
Yeah.
Okay. So just try and remember that it isn't a summary or a description, and descriptive writing is not what you need with the reflection. So if we go on to the next slide, please. So when you're reflecting, and we might continue with the glucometer thing, it's important that you make time to do it. So obviously you'll be sitting down to do your portfolio, but it isn't something that you can say, right, I'm going to reflect on yesterday's work. It doesn't really work like that, because you need to have, I'll carry on with this one. You need to make that time. And then we've talked about having that structure. So because it needs to be methodical in your approach. So the structure is good. You don't have to have a structure. But if you don't, what you'll find is that you waffle all over the place and you never really get to grips with it. But we don't want it to be too rigid. Obviously, Gibbs is the one that you're using, and it's there because those questions sort of follow along nicely, and you can see the method and the sequence that is being used. But remember, I told you about that other one, the so what, so what, now what. Valuing the benefits we talked about was, again, it is useful. It's a chore at the moment. It's painful. You know, some people aren't navel gazers and they're very sort of practical, and it's, you know, it's here, I'm doing it now, and then I'm moving on. This is a different sort of concept of, you know, I'm going to muse, I'm going to think about things, as opposed to, right, you know, chop, chop, all done, move on. And unfortunately in healthcare, we do need to look back. We do need to see where things go wrong and also where things are good. You know, this is a very safe process and we're going to stick with this. You know, somebody might suggest something, doing things differently, and your managers or lead GPs may well say, no, we're very safe. We've worked on this for a long time, and this is, you know, what we're going to do. So these are valuing the benefits of that reflective practice of looking back and seeing that something is okay. When reflecting, it's quite useful to just do short notes. So, you know, you're in clinic and you're with a patient, and I know, you know, one after the other, but unless you make a note, a quick note, and it might be just patient with foot checked and a date, and then you can sort of go back and think, what was it about that incident, that patient, that encounter, that consultation that made me think this might be a good one to reflect on. So you'll need to do it that way. And I think I referred to it another one. It's like, let the patient come to you. You're not then sort of on, oh, I'm doing my portfolio today. Oh, what shall I think about? Oh, let me think about what I did yesterday. Is there anything I can write about? It doesn't work like that, because there's usually nothing. There's a gut instinct that says, oh, this might make a good reflection. I can try and remember which one it is. And just throw down a couple of bullet points in your notebook. Your voice recorder on your phone, again, I mean, I've never done this, I have to say, but this is technology moving on. And so this is meant to be a really good way as well of sort of keeping your notes together, to use your recorder. Again, patient confidentiality, no notes, things like that, you know, diabetic patient, male, whatever day is enough just to have it, or your notes on your phone. So these are things that you then, when you do sit down to do your reflection, you've got a prompt as to what it is you want, or what patient it is you want to talk about. So next slide, if that's okay, Summer, please. So the type of things that, the questions that you should be asking are basically along here. So I know we've given you that template on the Gibbs cycle, and you can see here on the left is, you know, why is it relevant? And you won't need to answer all of these questions because it will depend on the scenario that you're having. And all the time here on the right then, like I said, keep that what, so what, now what in your head. So why is it relevant? So what was it about this particular thing that made you make a note, made you think about it? Was it the patient was difficult? Was it an interesting case? Was it you hadn't come across this before? Just a little note about why that particular incident jumped out at you. Remember, we talked earlier about you reflect all the time. The going out in the morning, closing the door and leaving your keys inside. why was it, what was it about that particular day that made you think, oh, I need to sort of talk about this? Um, how and why did you do it? What particular sort of patient, like I said, just to talk about that? How did you approach it? So, and sometimes that's your reflection. It's, you watched what went on, and then you sat down, you thought about, oh, if it was positive, if it was negative, things like that that would just make you start thinking about your emotions around it. Professional boundaries, again, really important. What would you do if somebody asked you to do something that you felt uncomfortable with, that you said, oh, I don't think that's actually going to be part of my role? How would you address that? That would be a perfect, very nice reflective thing. Do you have a conversation with the person that's asked you? Do you go back to your mentor? Do you go back to your practice manager and talk about a job description? This is how you would approach it, and the emotions that are going on. Do you need more knowledge? So is that when you analyze it all, is that what you're going to come out of it to say, oh, I don't know very much about glucometers, about why around the sugar, why is that important, particularly for diabetics? Would I use it with non-diabetics? When might I be asked to do this? And so you would go and read into and gain some more knowledge around what it is, and reflecting and saying, I need more knowledge, again, is being very honest and very open. And then you're identifying a learning need, and you're going off and getting it. Identifying that you might need help from somebody else. So again, Praxi, you've talked about, you've already discussed it with your manager, you've already brought it up with somebody else, you're using the whole team. So again, you're demonstrating that there's a wider team out there that can support you in your learning and in your portfolio, and as a reflective practitioner, that you're aware of that and you'll use them. And again, encourage others to work with you. So again, within the PCN, there are so many different roles, and always quite useful to be aware of what some of these people are doing, even if it's just for a short while, to sit with them, and again, reflect on how that helps support your role. I'm talking a lot about gut feeling, and again, when we talk about reflections, gut feeling is that, why this patient? What is it about this scenario or this patient or this encounter that has made you think I'm going to do a reflection? And it's usually that gut feeling, in the way that I said the patient came to you, you remember them for something. And if your gut is telling you something, then it means you need to think broader and wider about the situation. And so that's really important when we're talking about reflection. So what are you taking away from the encounter with that patient? What is it that's sticking in your mind? And the emotions that go with that. So if we could go on to the next slide now, Summer, please. So what did you take away? And I've just talked about here, the patient is coming to you rather than you saying, oh, I'm going to write my reflections. What's sticking in your mind? I'm talking about the emotions. And so these are some of the emotions that you might want to discuss or want to include in your reflection around whatever it is, whether it's about a meeting or an encounter with a patient or an encounter with a member of staff. Were you pleased with what had happened? Were you proud? Did they say something to encourage you? Did you feel guilty because you weren't aware of what to do? You went and got help, and you felt guilty that you weren't able to help the patient, or you had to go and ask for help, or you're feeling out of your depth. And any of these and more, you can go on with lots more emotions. But when you're putting it into your reflection, it's quite useful to just consider a couple, 2 or 3 of those emotions. And then that makes the reflection a lot more personal and a lot more rich. And we talk about the richness of the thoughts that are coming out of it, rather than I was happy, it went well, is one way, but actually admitting to your other emotions is a really good way of completing those frustrations. And again, if you're unsure, just think about, you know, the key scenario. You've walked out the door. What is the thing you do? You go, oh, you're cross with yourself. It's okay, you know, to say I've made a mistake and next time I'm not going to do it like that. So it's those simple emotions that you want to write into your thing. When I say start at the bottom, what I mean is when you look at the Gibbs reflection and you start at the beginning, what happened, describe what happened, or what is your scenario. We always start off very, very enthusiastic, and you start writing, and it does become very descriptive because you feel you have to lay it out for everyone, the whole scenario. So the patient came in, they were this, they, you know, it just becomes very, very descriptive. And by the time you get down to the bottom to what's your action plan, you're almost worn out. You're just, you know, you're overthinking it, and you're fed up, and you're then writing bullet points. If you start at the bottom, because you've already this scenario has already been going on in your head. You've already been thinking about it. It should have been something, you know, what is it? What was it about the whole thing that made you think of this particular one? What emotion was there? So you're already thinking, I know what I'm going to do. If I come across this situation again, I know what I'm going to do. So you write that becomes your action plan. And if you work up backwards so that the last thing you write is actually what the scenario was, you're going to make that last bit, what the scenario was, really succinct. Whereas when you start it the other way around, like I said, you're inclined to say, a 67-year-old patient who came in late, they said, he said, I said, it just becomes, and by the time you've got back up, you're, like I said, succinct, to the point, just the bare bones of what is needed rather than too much detail. And it avoids some of that descriptive work that we think about. And I think I've got another one. I'll pick some of those up. Is there another slide, or am I... Summer, is there another slide, or have I finished?
No, that's all of them, but there are a few questions in the chat, if that's okay.
Okay, yeah. So just to wrap up really, and yeah, we can pick up and have some examples. That's me trying to say it's not scary. It's a bit academic, but we want you to forget about the academia bit and just think about how you do this every day of the week when you're going out yourself, or you're cooking. Cooking is a really good example, isn't it? Because it is about combining things and then thinking about, well, you know, was it okay? How wasn't it okay? And things like that. So I'll look at some of these questions where...
First one, I'm finding it a bit trickier to do reflections for things that don't necessarily have practical actions to do, specifically summarising, for example, managing health records.
Right, and yes, I can imagine that it would be, because there's very little emotion, I suppose, really, isn't there, when you think about it, except think about the importance of summarizing those. So why are we doing it? So the what, so what, so and now what. So the what is, it's important to get information onto the computer, because the computer is, and the patient record, computer records is where we are, where everybody looks. Nobody goes back to, you know, paper records, or and there's too much in there. So summarizing is really important. We talked about patient safety. We talked about, sorry, my phone keeps ringing. We talked about patient safety, the reason that you would be doing that, the why you're doing it is really easy to put in without being too descriptive. And the action plan would be, have you any tips or tricks as to good ways to do it, important things? So usually, again, in practices, they'll have a sort of a, have they got a template, or long-term conditions, allergies would be very important. You know, what are the things that you've been told are important? And have you come across any situations where something wasn't on their records and you felt that it should have been? So, and discuss. So something like that would be useful. There's always a why we're doing these things, that you can then think about, what if that is missed, what the outcome would be. you know, that's why it's important that it's on there. So somebody's allergy, for example, is really important if you're summarizing to make sure. So the reflections that have been added, are they wrong? We wouldn't say they're wrong. We're trying to enrich them. So it's a process, and you start somewhere. Your first one, like I said, I alluded to it earlier, you know, keep a log, go back a couple of in a couple of years and look at what you wrote. And would you write the same thing today? You probably wouldn't. So this is your growing as reflective practitioners through the whole process. And instead of thinking, oh, I need to do whatever 2025, sometimes you will do more, and then you'll or you might go back and reword it. You might look at it a bit more critically and think, okay, that is a bit descriptive. I'll take that out. Like I said, turn it on its head, less description and more of an action plan. So I don't think we've said any of them are, have we, Summer? Because they are personal. That is the thing. It is personal. So we can't really say it's wrong because it's what you feel and what you think, but we'd like more of the feeling rather than the doing, if that makes sense. And the why you're doing it as opposed to what you're actually doing. So the glucometer bit is I take it out of the drawer, I turn it on. That's all description, but why you do it is the important bit. Could I have an example of an expected reflection, something that so there is one on Google Classroom.
Yeah, so in the Google Classroom, in the reflection guide at the bottom, there's a example reflection, I think, about hand washing, a technique where the mentor wasn't washing their hands and the GPA witnessed it, and there's that example in there. It's very long, not what we're expecting for everyone. I think it's nearly 3 pages, so just bear that in mind.
Yeah, I mean, I read one recently, and it was around phlebotomy, and I think it was around somebody who, when they did their training, or had worked with somebody, they were just really scared about an old, frail patient, and so lo and behold, they're being assessed. And it's the old frail patient. And they think, oh my gosh, I know these have always got, you know, terrible veins. And so got themselves really in a panic about this is going to be awful, this is going to be awful, but carried on with the procedure, and actually it was okay. So the learning was, I'm not going to panic, I'm not going to have all these preconceived ideas, I'm just going to stay calm, everyone is individual, and that was the action plan coming out of it. So there, I've given you a phlebotomy one now, haven't I? Something around that. Shall we take Linda's question, because her hand is up?
Very quickly, the minimum maximum word limits, there's no minimum, but we would probably expect more than half a page, because otherwise there wouldn't be enough space to reflect. But so I would aim for kind of half a page to 2 pages. And then Linda.
Oh, hi. I had a question about if you're on vacation, so you're gone for the week or 2 weeks perhaps, do you have to submit reflections to make up those 2 weeks, or how does that work? Because we're doing one every week at the moment if you're currently enrolled in the program still, yeah.
Yeah, so what I've been mostly saying is you need to do one for each week that you're on the course. If you're away, you don't need to be doing one. But I think for most of you, you will be on the course for at least 6 months, if not a little bit more. And I would aim for about 24 reflections based on that. But if you are away, you won't need to do one for those weeks, but you might find other weeks there's a bit more to talk about as well. Is that, Nora, is that what you
Sorry, finished the modules and you are at a stage, I'm not there yet, but if you're at a stage where you're maybe just waiting for phlebotomy, you would still have to do a reflection every week, even though you've sort of completed your modules. And perhaps, I know you said you needed to at least attach several reflections for each area, and make sure each area is covered with a reflection. So if that was done and you're just waiting for, I mean, perhaps in the next couple of months, the phlebotomy will be not an issue. But if that was the case, would you still have to do one every week if you're waiting?
No, so if you have finished your course for everything else except for the phlebotomy, then you can stop doing the reflections, provided you've kind of done that enough, which assuming you should have anyway, because the phlebotomy should only be kind of that 1 week, one reflection anyway. So no, you would be able, if you finished everything else, you should have all your reflections for that stage anyway. So you would just have to do the phlebotomy once you were there.
All right, lovely. Thank you.
No problem. Are there any other, I was about to say any other reflections, any other questions?
Hello, Summer. It's me, Brenda.
Hi, Brenda.
Hi. I think I'm doing my reflections every week, but I still find it like difficult. I don't have a mentor, and it's like he's keeping me behind because however much I'm doing my reflections, I'm not doing any the other bit of the clinical thing. So I don't know what you think about me because it's been an issue since I started and it's still going on and on.
Yeah, of course. I reached out to your PC manager, but I'm guessing you didn't hear anything following that.
No.
Okay. Right, no problem, Sharon. Thank you for joining. Okay, so have you all other areas except for the clinical, have you been able to work on those?
Yeah, if you go through my reflections, you can maybe give me a feedback.
Yeah, sure thing. Absolutely. I can have a look at those later this afternoon.
Okay. All right. Thank you so much.
No problem. What I might do is stop the recording now, and then if anyone does, not to stop the questions, but if anyone has any kind of other questions, then that is